So we know for respiratory that it is a key priority, so the variation data tells us that we have significant variation for respiratory within the Cheshire and Merseyside Healthcare Partnership. We also know that nationally respiratory has been prioritised, it's clearly named within the long-term plan and we need to align ourselves to that. What we know from the data is that we could really improve clinical outcomes for our patients within Cheshire and Merseyside. And we spend significant amounts on respiratory, but the question we really need to ask ourselves is whether we're getting value for money and whether we get the best outcomes for our patients with the money that we spend.
Absolute passion across the whole of Cheshire and Merseyside to improve respiratory services. It was evident in clinicians, commissioners and everybody that I spoke to. There's significant variation in care across Cheshire and Merseyside, particularly in relation to the services that are available for patients to access. It really does vary from place to place and patients have different services dependent upon where they live. To really make sure that we're treating the right patients, they have to have access to high quality ARTP standard spirometry. Once we've identified the patients, it's really important that they get access to the interventions that really matter and the right treatment. So the most important interventions in respiratory disease are flu vaccination, smoking cessation support and access to smoking cessation services, and access to high quality pulmonary rehabilitation. Once we've identified patients, we can make sure that they're on the right medications and know how to use their inhalers, because many patients don't know how to use their inhalers correctly. One of the other things that I found through the review is that we don't have a big enough workforce in Cheshire and Merseyside to really affect change. So through funding that we've managed to secure from the Health and Care Partnership, STP transformation funding, we've managed to employ 8 physician associates to work across the whole of Cheshire and Merseyside. They'll be delivering care in primary care over the summer months to improve the management of patients with COPD, and there's also an opportunity for them to optimise the treatment of patients who are high intensity users of secondary care services to try and get appropriate interventions and treatments in place before this winter. They'll also be able to this winter bridge some of the service gaps between A&Es and community services and primary care. They'll understand all parts of the system and can try and help to navigate people to the most appropriate place to be cared for.
So what we're asking is that you get in contact. We want to create a respiratory network within Cheshire and Merseyside that leads the strategy going forward for our patients. So please get in contact. We've got additional information that we can share with you. We've got support that we can provide, but in order to do that, we need you.